Hello, and thank you for joining us for the first of two information sessions on returning to work on campus. This session is intended for managers and supervisors, though all are welcome here. We're delighted to have this time with you today. My name is Becky Mangini, and I'm the Vice Chancellor for Human Resources and Equal Opportunity and Compliance. I'm joined by a number of my colleagues from HR and across the university today, and we hope to use this time together to talk a little bit about returning to work on campus and the work being done to prepare for a broad-scale return on July 19th. We'll discuss the new community standards and the health and safety precautions in place, and we'll talk about your mental health and how to take into consideration the impact last year has had on your teams. We'll spend some time talking logistics, and we'll also provide some specific guidance and resources for you to use in your role as supervisors. We'll then close the session by collectively answering the questions you submitted when you registered for this event. Slide. I just talked about this slide, so I'm just catching up. Bear with me. But before we get started, I want to just also point out that those of you who are watching on YouTube, the chat section is not going to work on YouTube. You'll all recall you submitted questions in advance. So when we close the session by collectively answering the questions, we're going to answer the questions you submitted in advance. Please do not use the YouTube function today. Before we jump in, I want to take a minute to first acknowledge all that we've been through together. I think it's fair to say that the last year has been a doozy, to say the least. None of us knew when we made that initial transition last March that it would be 16 months before we'd all be back on campus together again. We've all had to pivot and adjust, and frankly, not just once. We've all also suffered loss in some way. And if you're anything like me, there have been times when you've struggled. I get it. And for some of you, the prospect of returning to campus is inducing anxiety. Perhaps because to you it feels rushed, or because now you've just grown comfortable in the most recent pivot and you're not ready for another. I get that too. And yet our campus is founded on the notion that we are a robust residential community that depends on, and in fact is built on, the free exchange of ideas between faculty, staff, and students in a common physical space. The virus caused us to pivot away from that residential and interactive part of our mission temporarily. But now that we better understand the virus and have collectively controlled its spread, the world is opening up and we're being called to redefine the Carolina experience in the new abnormal, as the chancellor likes to say. We'll make this pivot together though. And after today, we hope you'll be a bit more prepared for what comes next. So throughout the pandemic and even before, we've led with the premise that the well-being of our community is paramount. And that remains true as we anticipate this return to campus on July 19th. We hope to be able to have a final release of the new community standards, perhaps as early as later today, but likely later this week. But the key takeaways in the new community standards and what you should expect upon returning to campus is that masks will be required indoors, in all indoor spaces. And we're going to start that way and evaluate on a regular basis, particularly on or around the fall break time, to decide whether, as things continue to open up, we can release or reduce the mask requirement. But given sort of where the science is going, we believe having masks required indoors is necessary. Masks will no longer be required outdoors. The one exception to the indoor rule, and actually maybe one is probably not the right framing, but is that faculty, when and where appropriate, particularly, or faculty and instructors in front of classrooms, will have the opportunity to remove their masks as long as they can maintain 6 feet of physical distancing, if they choose to, with the idea that it may improve their ability to teach in the classroom. We do anticipate that all unvaccinated students will participate in testing at least once a week upon our return, and that we will no longer have restrictions on gatherings, classroom spaces, and building access. Importantly, in the new community standards, there are no longer requirements for physical distancing. So the key takeaways here are we will no longer have a 6-foot requirement for keeping distance between one another, and masks will be required in all indoor spaces. Several of you are going to say, well, what about if I'm in my own office with a closed door? That would be an exception. What about if I'm eating It's hard to eat with a mask on. So there will be some adjustments. Likewise, there are some adjustments made for students in residence hall rooms with their individual roommates or their suite mates. But by and large, masks will be required in all indoor spaces. Beyond the standard, though, there are several things that we think it's important for you to know to help model and support the well-being of your team as we anticipate the return. And for more on that, I'm going to turn the mic over to Kathy Brennan from Environment, Health, and Safety. Kathy?
Thanks, Becky, and thank you for including me in this important information session. So I'm going to focus my portion on workplace safety, and I'm going to share the most up-to-date CDC guidance, some current stats regarding infection and vaccination rates, and also highlight prevention strategies that UNC has in place. Next slide. So in terms of the CDC, UNC has been following CDC guidance and also North Carolina Department of Health and Human Services throughout the pandemic, and we will continue to do that. The CDC did update their guidance for institutes of higher education at the beginning of June, and they basically put it into two different camps, colleges and universities where everyone is known to be vaccinated, and those where not everyone is known to be fully vaccinated. So UNC falls into that category. And as part of the CDC guidance, you are supposed to determine what factors you need to take into place to implement a layered prevention strategy to ensure safety at the workplace. So some of the primary factors to consider include community transmission, vaccination coverage of your community, robust and frequent screening or surveillance testing, and then also tracking any COVID outbreaks or increasing trends that might be occurring in the community. Next slide. So in terms of just some stats for you, in terms of the level of community transmission, this data is from yesterday. So in North Carolina, we're doing really well in terms of our current percent positive rate. We're currently at 2.7%. From all throughout the pandemic, they've said we should be below 5%, and we've been maintaining that for several weeks now. Here in Orange County, our 14-day percent positive rate is extremely low. We're at 0.5%, and again, have been for several weeks. And then closer to home here at UNC, our Carolina Together testing program, which is our screening program, since the beginning of June, our percent positive rate is at 0.04%. And so that really translates to we only have two student positives since June 1st and 3 employee self-report positives since June 1st. So again, we are tracking just like the county, the state, and the United States in the decreasing rates that we're seeing. Next slide. And then another stat that a lot of people are interested in is vaccination coverage. So you can see from this chart here in the United States, currently about 46% of the total population is fully vaccinated, and 54% of the total population is partially vaccinated. Here in North Carolina, we're a little bit below that with 42% fully and 45% partially vaccinated. But if you look at Orange County, we are, I believe, the top county, or at least 1 or 2 in the top in terms of vaccination rates. So in Orange County, 62% of our total population is fully vaccinated and 64% is partially vaccinated. We are asking that employees self-report here at UNC, and unfortunately, we've only had 27% of our employees showing up as being vaccinated in terms of self-reports. I do want to emphasize that that data is protected. Your vaccination status is never shared with a supervisor or departments. We really are using this data for a broad picture of our campus rate. And so we definitely encourage people to self-report their vaccination status. We do assume that we're probably closer to somewhere around 50% or even higher, just based on the stats that are in the table above. But again, we do have a self-report mechanism. We highly encourage folks to do that. The link is in my slide, but you can find it on the Carolina Together website as well. Next slide. All right, in terms of the layered prevention strategies that we've put into place here at UNC, so the number one thing that we've been trying to do is most important is that we've been offering and promoting vaccination. There are 2 spots on campus where you can obtain a vaccine. The Friday Center has the UNC Health Clinic that has been in existence for quite some time. And then Campus Health and also the Campus Health Student Stores Pharmacy offers vaccines to all of the UNC community. So that also is available in the student union. One thing to note on vaccination, students are required to attest to vaccination status as part of their registration for the fall. And then, as I've already mentioned, we are encouraging employees to self-report vaccination. And as you know, there are leave provisions to obtain vaccine, and also if you potentially have side effects, and those leave provisions have been extended. So again, if you have not received your vaccine, we highly encourage you to go get one. The second prevention strategy we have in place, which has already been mentioned, is our mask mandate. So we are going to have a mask mandate inside all university buildings. This is more conservative than the state, county, or town in regards to fully vaccinated individuals, but we believe that that is the best thing for the current climate that we have. And again, we are going to reevaluate after several weeks. And then in terms of physical distancing, as was just mentioning, that is going to go away, but we're going to continue to promote that through signage. And if people feel more comfortable physically distancing, that is definitely going to still be in place for some folks that want a physical distance. Hand washing and respiratory etiquette. Again, we promote this through signage. We're making sure that our bathrooms are stocked with soap and paper towels, that we have hand sanitizer stations. The hand washing and respiratory etiquette is important not just for COVID, but for our upcoming flu season. So we'll continue to encourage that throughout the fall. Next slide. Some of the other strategies that we have in place, contact tracing in combination with isolation and quarantine for known COVID positives. We've done this throughout the pandemic, and we will continue to do it. Campus Health is a lead for students, and the Employee Occupational Health Clinic covers it for employees. And again, we're going to continue to do that to make sure that we can stop the spread as soon as possible when we do find out about positives. Testing, I've already mentioned, we do have surveillance or screening testing via the Carolina Together testing program, and students, faculty, and staff can all participate in that. Symptomatic students are going to continue to go to Campus Health for testing if needed. And then employees that might be symptomatic, obviously you should not come to work, and you can contact your primary care provider for access to testing. And then we've gotten a lot of questions about maintaining healthy environments in our buildings. And Facility Services has implemented enhanced cleaning procedures throughout the pandemic, and will continue those through the summer and fall. And they've also done quite a lot of work in terms of their HVAC systems in buildings. This is involved ensuring that those HVAC systems are performing as designed, but also they've upgraded building box filters to a higher efficiency filter, MERV 13s. And they've also looked at increasing air rates when possible with building systems. And then finally, just maintaining healthy operations in terms of making sure that we're communicating things out. We have supportive policies in place, health equity. So again, a lot of information can be found on Carolina Together, the website. Anything that is updated will be posted there. A lot of individual units have websites. I know EHS, for example, has a website with content on it. Facility Services does as well. So I would definitely encourage you to check out those. Next slide. And then tips, I just want to end with some tips for workplace safety. I've already emphasized vaccination, and I want to say it again. Vaccination is the best way to prevent COVID-19 transmission. So highly encourage people to get vaccinated if they are able. And then I also want to emphasize that you should follow UNC community standards when you're in the workplace. I know there's different standards maybe out in the community that you're living in terms of when you need to wear a mask, when you need to physical distance, that sort of thing. So just make sure that you're following UNC community standards when you're at the workplace. And again, you can always be more conservative than UNC community standards. It's what you feel comfortable with. If you want to wear a mask when you're outside, even if it's not required, that's your personal decision. And everyone should be supportive of that. And then finally, as we've all seen throughout the pandemic, guidance changes, and sometimes rapidly, but it's typically changing based on current trends locally. So continue to follow closely the UNC guidance, because we do anticipate that changes could be made in the future, depending on what's happening. And that's all I have. Thank you.
Thank you so much, Kathy, both for these comments and your leadership, both in anticipation of a broad scale return and support of those who've already been on campus and have been on campus throughout. We owe that group an enormous debt of gratitude as well. I opened today's session by acknowledging the difficulties of the past 16 months. That's not to say there haven't been wins too. That we pivoted an organization this large and not only kept the institution moving, but helped it and its people thrive is really remarkable. That's thanks to all of you. We learned to use new technology, figured out that more than a few meetings probably could have been better managed as emails, and we were forced to think of new ways to deliver on our business purposes. As we return, we know that not everyone is in the same place, and we know that the last year has been tough for lots of reasons well beyond the pandemic. It's important that you all consider the mental well-being, both of yourselves and that of your teams, as we approach the return. To help us along the way on that front, I'd like to introduce Susan Gaylord, Director of the UNC Program on Integrative Medicine and Director of the UNC Mindfulness Program, to help us think through some of these items. Susan?
Hello. Can you see me yet? Am I on? I can't see myself, so that's fine.
You're good.
All right, great. So thank you so much for inviting me. I want to stress in this very brief talk, because I know everyone wants to get to the questions and answers, and I know you have all the answers, right? So we are going to talk very briefly about the role of managers and how we can set the tone for returning to work, with examples of mindfulness and compassion as two or more ways of becoming, embodying the best that we have to offer for our employees. Next slide. So in this very brief session, we'll just talk a little bit about recognizing hardship and using tools of mindfulness, and specifically a practice called breathing space, as well as communication tips for having empathetic conversations and real conversations with employees and with ourselves. Next slide. So as has been said, these are unprecedented times, and that's not a cliche. That is, I don't think any of us ever expected anything like this in our lifetime. A pandemic combined with illnesses and family and economic hardships, racial turmoil and racial justice concerns, mass shootings, global warming, buildings collapsing out of the blue. What more could we add? Next slide. All of these events cause stress and perhaps trauma, even on a large scale. Stress, as we know, is emotional and physiological reactions to events that the organism finds emotionally or physically challenging. And chronic stress is well known to lead to anxiety, sleep disturbances, poor coping, such as binge eating, substance abuse, as well as depression, illness, and burnout. Next slide. So returning to work will require an adjustment for all of us, a physical adjustment, definitely, as well as a psychological adjustment. And this adjustment in the process can trigger trauma in itself, just reminding ourselves as we return to work of the trauma of the past year. We may have fears of illness. We may have uncertainties about our safety. We may have concerns about people we've left at home after having been a year with our pets. What will they do without us? But we're all in this together and we can figure this out. Next slide. Actually, returning to work could also be a source of relief for some, returning to a familiar work environment and renewing some of our friendships, people we haven't seen, as you said, 16 months, amazing, and seen in person. We have the positive of increased peer support, talking among with ourselves and our colleagues. We have increased social connections, especially if we've been isolated over the past months. We have perhaps more certainty of economic recovery, knowing we actually have a job and we can go to work. Again, this is something that affects all of us, managers and employees, and we are in this together. Next slide. So as managers, we can have a tremendous difference in our employees' experience. And these are some of the tips that I would say from a mental health perspective that we can employ. First, always be honest, recognize and empathize with the hardships of others. Be open in expressing and sharing your concerns as well as the concerns of those in your workspace. Acknowledge the importance of self-care and always encourage your employees' efforts in that regard. And of course, look out for your own self-care as well. We may have to be particularly sensitive to self-care in this as we are undergoing not only the transition, but over the past year, the stress that we have had and the traumas that we may have had during that past year require us to be very careful about keeping ourselves healthy and mentally stable. Acknowledge the uncertainty and recognize that things are going to continue to change, maybe on an hourly basis. Be sensitive to possibilities of trauma and psychological distress. Be flexible whenever possible. And of course, show compassion and kindness. And as I said, both random and non-random acts. Maybe be a little more thoughtful than we usually are, which I'm sure is quite thoughtful. And then finally, very importantly, have a good sense of humor. That is, we all know, helps us to alleviate stress, but it's also, it's just good for the overall morale of the workplace. Next slide. So mindfulness is one tool that we can use, and many of you are already aware and may be using mindfulness, but is a good tool for enhancing our awareness, our sensitivity, and our compassion, as well as our resilience. Resilience is a really good word that we can be using now. It's a process of adapting in the face of adversity and trauma and even tragedy. We're able to bounce back. Not that we don't experience these events, but we're able to come back. And mindfulness has been shown with research to enhance resilience and also decrease sense of isolation, depression, and burnout. It's also been shown to improve our ability to regulate emotions and to have true empathy for our fellow human beings. as well as to enhance insight and increase creativity. And we do need creativity in order to cope with all the different changes that are being made, and it may be even changes that we are yet to come. Next slide. So now I'm going to offer a very brief practice called breathing space. And if you like, we can do this together. So one thing I love about this particular mindfulness practice is that you can do this anytime, anywhere, and for a short length of time or a long length of time. You can easily use it. For example, if you are sitting at your desk and you're just thinking, oh, I can't take this anymore. Stop, just stop. Be aware of what is going on in this very moment, which you can do right now if you like. Take a deep breath and just be still for a moment. Notice what's going on in your body, in your thoughts, your emotions. Notice what's going on in the environment. Not needing to change anything, just being with that. And then shift your attention to your breath. You can just notice your breath as it goes in and out, not trying to control the breathing, just being with it, allowing it to flow in and out. And if your mind gets distracted, just bring it back to the breath. Once you've had a moment or two, or as long as you like really, to just be present with yourself, with whatever is going on, then shift your attention again outward to become aware of the body, your thoughts, emotion, and the environment. Notice if there's been any kind of shift. Notice that in some cases, the environment may just feel a little bit brighter, a little bit softer. Allow it to be as it is. And then you can, if you like, say to yourself, whatever it is, it's okay. I can deal with it as it is. I can handle it. Just let it go. And then go back to work. So, next slide. Another really important exercise or activity is mindful listening. So we're not going to go through this now, but if you are at work and you'd like to work with mindful listening and mindful communication, you can practice it with your colleagues. You can, for example, set a timer, and you can actually sit down with another person and say, let's just talk. I'd like to hear what you have to say. What's your experience been like over the past 16 months? Allow that person to just talk. Don't interrupt them. Don't judge them. Don't feel that you need to give them advice. Allow them to speak. And longer is better, because people will end up saying things that you didn't even know about that person. You might want to, can really hear what their life has been like. And as you're sitting there, notice your own reaction. Do you have a sense of softening and empathy? Or are you just distracted and you just can't wait to say what you want to say? Those are just things to notice about yourself. The more you can actually be with another person as an authentic human being, just you and that other person, the more you can be able to respond in a sensitive and compassionate and positive manner. You can take turns, then allow yourself switch roles. You can even do this in a small group. People have done this when they call counsel, using a talking stick, which could be a flower or a pencil or anything. You hold it though, and when you're holding it, you get to say what's on your mind and heart. And no one has to respond to you. No one has to be critical or judgmental. Just allow them to speak. And then shift to the next person, pass the stick, and then the next person. And you'll find that this is a way of bringing back some kind of rapport with your colleagues and with your employees. And it can help facilitate all the other good things that we as managers need to do in being with our employees in this very, very challenging, but potentially very positive time. Next slide. I'm not going to go into this, but we of course have other mindful techniques such as having self-compassion and then just taking care of yourself. If you have trouble really taking care of yourself or deciding what you need, consider yourself as if you are your own best friend and think, well, what would my best friend advise me to do? That's often a way to reflect. Your own best friend might say, you know what, you need to take care of yourself. Maybe you need to go home and don't take work home with you. Just go home and rest and be with your children. You may not even advise yourself that, but when you think, what would my best friend tell me? You can often do the right thing. Okay, next slide. This is for further information. If you all are interested in learning more about some of these techniques, and there are many, many more, we certainly can guide you in doing that. And I wish you best of success in making this transition back to work, or I should say in the office, because we've all been working very, very hard all year. Thank you.
Thank you so much, Susan. I think you provided us with some excellent tools, both to navigate for ourselves as managers and supervisors, and to think about how we might use with our teams and our employees as we anticipate a return. I should point out, and I should have done at the beginning, we are going to post these slides at the hr.unc.edu return to work on campus site. So you will have access both to the tools that Susan laid out today and to some of this additional contact information about resources, because part of what we're hoping that you take from today is a sense of the resources that you have to help you navigate as a manager and a supervisor, and a sense, as Susan said, that we are all in this together and you are not being asked to stand on your own or be alone in any way at all. And now to brass tacks. Not surprisingly, many of the questions you all asked prior to today's session were about logistics. You wanted to know about parking and bus transportation. You wanted to know if the tents will stay on campus in the fall, and the answer to that is yes. And you wanted to know about things like ADA accommodations, should your team members need them. Cheryl Stout is here from Transportation and Parking, and Elizabeth Hall is here from the EOC office to walk us through some of these things. I'm going to turn it over to Cheryl first and then to Elizabeth.
So good afternoon. Thank you for having me. Just a little bit of information about transportation and parking. So the July 19th is the 31st time frame. Parking permits are available. Recommend that all employees contact their department coordinator to request parking if you plan to return on that date. Once the coordinator sends those assignments to transportation and parking, employees will receive an email where they'll have to log in and pay online for the permit for the 2 weeks. If you are working 3 days or less, you will be eligible for the flex rate. So make sure you communicate that information with your coordinator for that time period of July 19th through the 31st. The academic year, the new parking permit year for 21-22 will begin August 1st. Your parking coordinators are also working on those assignments right now with your department. So just make sure that you reach out to your parking coordinators relative to your parking assignments for the fall as well. Of course, payroll deduction will be available for your annual permits. And then again, if your schedule is 3 days or less per week, you will be eligible for the flex rate. That is something to discuss specifically with the parking coordinator when you request parking. Transportation and parking accessibility. If you have an accommodation need, including that public transit is just not possible due to COVID, based on your circumstances, there are provisions available. So please see the application link where you can go. Our Transportation and Parking Accessibility Committee reviews those requests twice a month. So just recommend that employees that may have those specific needs reach out through that application process for accommodations. And that's my update.
Next slide, please. So as we have throughout the pandemic, the Equal Opportunity and Compliance Office will continue to facilitate accommodations for employees, particularly for employees who are unable to be vaccinated due to a disability, employees who have a disability that continues to require accommodation after being vaccinated, for example, being immunocompromised, or employees who are unvaccinated but have a disability that puts them at greater risk of contracting COVID-19. As we have throughout the pandemic, we are only providing accommodations based on the health needs of the employee themselves, not family members or cohabitants. The major change I want to highlight from how we've handled these requests so far in the pandemic is that we are now requiring complete medical documentation from a healthcare provider documenting the employee's medical need for an accommodation. Those forms are available on the EOC's COVID-19 page. It is the employee's responsibility to ensure that we get sufficient medical information. So to the extent your employees have questions, we do encourage them to make sure that the provider fills those forms out completely before sending them over. The site has been up for a while now, so that's why you'll see that we did ask people to submit their requests by yesterday, which is 3 weeks out from our return to campus. We are still accepting requests though, if folks haven't gotten them in just yet. We are reviewing those on a weekly basis and notifying folks as soon as we're able of accommodations. For those of you who are managers, just be aware you may receive a request or a notification from the EOC office putting a temporary accommodation in place if we get documentation from folks on your team closer to that July 19th date, and we don't have time to finalize an accommodation before the official return. Next slide, please. So I'll just briefly highlight several resources that are available as we transition back to campus that can help you and your teams. The first is ITS. They are available to meet in person with folks to make sure all your devices and your workstations here on campus are up and running. And we do encourage folks to go ahead and meet with them prior to July 19th so that they can space out those appointments. Another resource that's available to everyone is the Employee Assistance Program. And I've highlighted here in particular that they do have counselors available 24 hours a day to deal with some of these issues listed here that we recognize folks may be dealing with either as a result of the pandemic or as we transition back to campus. For you as managers, Employment and Management Relations is also available to consult with you as concerns arise, as employees may be having difficulties with coming back to campus. They're also available to help you identify trainings and other professional developments opportunities that may that may ease that for everyone. So I encourage you to reach out to them early on if concerns start to pop up. And I'll just end by mentioning that you as managers are also an important resource on our campus for your employees. And there's two specific ways that you can be a good resource. One is that you are able to approve short-term arrangements for flexible work locations or flexible schedules for 30 days or less due to folks' special circumstances, childcare issues that are lingering from the pandemic, other things that are coming up. That's within your purview. You also have the option, and we encourage you to allow your team time to take advantage of some of these wellness programs and resources, both that Susan talked about and that will be on the HR website, recognizing that this is a time where people may need a little bit of compassion and care as we transition back, and we encourage you to give folks the time and space for that. So that's a really high level overview. I'll turn it back over to Becky so that we can get into some of the specific questions that folks had.
Excellent. Thank you, Elizabeth and Cheryl. And so now what? You've got the information about some of the resources. Again, we'll update the website so you can find some of that and include some additional resources as well. But we also want to advise a few key follow-ups for you as managers and supervisors. And as Elizabeth just said, we're really aiming to get people to create an atmosphere of patience, kindness, and empathy. When I opened, I said we've all experienced the pandemic together in some ways, and yet its impact on each of us has been different. And it will be important that we as leaders lead with kindness as we think about the various things people are worried about or excited about or nervous about or whatever it may be as they come back. So some employees are ready, others are not. Some want to work from home permanently and don't understand why, if they've been successful at home, why they need to come back at all. Some are anxious about their safety, while others have concerns about the racial climate on campus. All of these things are completely understandable, and your job as managers and supervisors is to listen and lead primarily with kindness. This is a big ask, and I know you're up for the task, and we're going to try to provide you, as I said earlier, with a few resources to help and ensure that you are not alone as you navigate this. We might suggest that you hold some meetings early on in the return to sit down, as Susan said, perhaps to just listen. What have people felt like they've lost? And what are people excited about in returning to campus? You might talk about standards for your workspaces and personal preferences. While masks are required in all indoor spaces, we also want to support and encourage an environment where employees have some agency in their feelings of safety. And as Kathy said, if wearing a mask outdoors feels best for some people, great. If going off site to lunch makes someone on the team anxious, maybe talk through a better option. Likewise, if there are things that we can be doing in the office that borrow from the lessons we learned during the pandemic, what are they? And how do we make those things happen? If you as the supervisor or the manager initiate those meetings, you're creating a sense of community and conversation that will make employees more likely to come to you as they have additional concerns or things they want to be addressed in the workplace. You're a very, very important part of setting the tone for how we return successfully, and we want you to be well positioned to do so. It will be key that you communicate with your teams, that you listen and lead with compassion, recognizing that a lot of this is hard and fun and scary all at once. Together, you and we get to help define the new abnormal for Carolina, and we're here to help. And we've got a number of referral sources available for you on the hr.unc.edu site. And our colleagues in employment and management relations, as Elizabeth pointed out, stand at the ready to assist you as you navigate the weeks and months ahead. So I think we should go ahead and transition to the most important part of the program, and that is your questions. We've reviewed all of them that have been submitted, and let me be clear, you all have a lot of questions, understandably, and we're going to try to address them sort of in key themes, because there's no way we can get through this in an hour if we try to get to all of them. We will, however, do our best to hit all the themes, and anything we miss, we'll go ahead and try to think about ways that we might ensure you get the information you need. And we're going to continue to add content to the Return to Work on Campus website, as I've said, on the regular. So you should check back there often. So the way I'm going to do this is I'm going to go ahead and read the question. If it's something that I can answer on behalf of HR, I'll do so. If it's something I need to pitch to someone else, I'll give them the heads up, and I'll rely on the folks managing the cameras to pivot and let the key leads answer. So the first question we got is actually about testing. And I mentioned, as I talked about community standards, that any student who is not attested to being vaccinated will be required to be tested. And somebody asked whether employees will still have the opportunity to participate in asymptomatic testing. And the answer to that is yes. What the frequency of availability will be remains a little unclear yet, but we're working on that. But all employees will have access to asymptomatic testing through the university testing site. The next question I've got is a little bit about the flexibility that people have been asking about. And it says, we've always allowed our team a bit more flexibility with their work schedules over the summer in terms of working from home periodically or adjusting their schedules due to camp drop-offs and pickups for their children. Will that still be allowed after July 19? So while we are definitely coming back as a campus, and as I started at the front by saying, part of our mission is to be a residential space for the free exchange of ideas. We don't intend this to become a more constricted workplace than it was prior to the pandemic. And we definitely want to learn from the things that we have learned over the pandemic. And we know that our personal lives and our work lives have bled together more in the past 16 months than ever. So you as supervisors will continue, as Elizabeth said, to have the flexibility to work with your teams and adjust. And we expect you to ensure that the business needs are covered and that the office coverage is maintained. But somebody needs to leave at 3 o'clock to pick up their kid from camp, and they said they can do their last 2 hours of work after 7 p.m. that evening, and you agree as a supervisor, that's fine. If you really need them in the office, you need to talk to them about that and see if we can figure out another alternate plan for them to manage camp pickup. But you do, as a supervisor, continue to have the authority to navigate with your employees. The key is that you do not have the authority to grant time off. You simply have the authority to grant flexibility in the schedule in those short-term agreements. You are not, however, authorized to provide a long-term remote work agreement. Those are all, any of those that we're putting in place will go through the pilot program. All right, so the next question is, somebody asks on the same line of thinking, I'd like to know how we support employees and provide flexibility to employees who will have childcare coverage concerns this summer. We've sort of addressed that. And the upcoming year, given the limited spots in daycare as a result of COVID, or who select virtual school options for their children, given a lack of vaccine and safety for younger children. This is a tough one, I'll be the first to admit. But the jobs that we all hold are university jobs on a residential campus. So we are focused on trying to figure out a way to best bring people back. If people need a longer chunk of time to navigate virtual school, and that's something that is a priority, that may not work in tandem with what we're trying to do in ensuring that the business needs of the university are met. If it's something that can be adjusted, as I said, in a short-term basis, as with the local supervisor authority, that's certainly something that that supervisors have the authority for. But we did work really hard, and actually I want to recognize and personally thank a number of the employees who raised thoughts and shared feedback about what our return should look like. Early on, we were looking at June dates, as many of our colleagues in the system were doing. And as the chancellor sort of talked to a number of advisory groups, people said, whoa, time out, it's the end of the business year, or business calendar, and we've got close of calendar year for the fiscal folks. We've got summer school. It would be much better to look at July dates. So we moved from a June 21st return to campus, which was the original plan, to a July 19th. And then we ensured that we had given people 90 days notice to start planning for a return to campus, with the idea that you could start thinking about your childcare needs or your elder care needs or your transportation concerns. And then with the idea that on July 19th, we're bringing employees back, and that's the first chunk. Well, actually, it's really the third, because we've had people working the whole time. Then research is growing the number of people who are on campus throughout the summer. Then we bring everybody else back on July 19th, and then the students come back in August. So we're really seeing this as a series of waves where we can test and learn along the way. So, well, for some of you, it certainly feels, perhaps some of you have said it feels rushed and it feels like a big thing all at once. It actually is a little bit more spaced out than you might realize, and there's a lot of intentionality and truthfully a lot of feedback from all of you in the process. And I want to thank you for that feedback, because it really has helped inform where we are. I hope that helps answer those questions. I'm going to throw one in the direction of parking. And somebody says, how are employees who take public transportation to work to judge the safety of doing so? And is it okay if only I and all the passengers within 6 feet of me are wearing masks? What other guidelines or assistance is there? And any other updates on taking public transportation to work? I'm going to throw that one to Cheryl.
Hey, thanks, Becky. So each transit agency is providing information relative to their COVID response. So I do recommend that you stay, depending on the transit agency that you would typically use, keep up with their websites related to the specific things that they're doing. Chapel Hill Transit is our biggest provider, and it's the local transit agency. And so is our Point to Point, which provides the inter-campus travel and transports our students. So mask, while social distancing is not in place, masks are still required. Chapel Hill Transit has updated air filtration systems on all the buses, added UV lighting, and continues with increased sanitation for the buses. So those are some of the safety practices associated with the transit operations. And I would encourage employees to check specifically with agencies for more details as interested or needed.
Thank you so much, Cheryl. So somebody asked why we have a need for the pilot programs for remote work, given that most people have been doing it successfully for the past 18 months. And they note that they understand the need for time to rethink policies, but why not trust your employees or managers to make good choices? This is a really fair question, and one we've gotten a lot. I want to be really clear. None of this is about trust. None of our plan for returning to campus in a broader scale is about trust. As I led at the beginning, I think the university as a whole has really, I think, exceeded most everyone's expectations. It's been a remarkable 16 months, a difficult one, I'm going to be very clear, but we have demonstrated that we can rethink lots of things about the way we work. We also did so when everyone was required to pivot, and when we had very few students on campus. What we're anticipating in the fall is the largest freshman class we've had to date, a sophomore class that's never been on campus, full 30,000 students, just because we were able to successfully do, for example, online library visits, and we did so in an amazing way, and our students loved it, doesn't mean that when we have 30,000 students on campus that they're all going to want to do library visits online. And so we need to use this time to come back and meet the mission, which was, as we said, and the jobs we originally took were all about furthering the notion of free exchange of ideas in a public setting. And we need to come back and evaluate that. So it's not that we don't trust people to do their work. And I do think we, the campus and leadership, are open to looking at more ways to be flexible, whether that's with scheduling or remote or other ways. but we need to look at what the new abnormal is before we make some assumptions about whether just because we did it in that setting can work. And the challenge with that is it's another pivot. And I understand that that's very difficult for lots of us, myself included, but it's really important that we do that. There is a pilot program, as you've noted. We have asked deans and vice chancellors to work and look at their units and identify primarily back office functions that are not focused on students or direct customer facing initiatives to test this, to see how we use the technology. It's not as simple as you think. If we were going to have flexible work arrangements, people who brought their chairs and their computers home, if they bring them into the office and then go away, how do we're not going to provide more chairs and more computers. So how do we navigate an in and out? And there are similar questions around how do we ensure we've got mentoring programs and we ensure that career development and advancement works the same for people who have some flexibility and those who are on site. So we have some infrastructure to build, and I realize that is not the most, that's not the answer everybody wants to hear, but we believe it is in the best interest of our community at this time. And we'll continue to work with all of you to think about how we might do things differently moving forward. Somebody asks, when will we be able to fill open positions that are necessary to return to the main campus operations? As you know, we're under a temporary suspension for HR actions. That suspension has been in place for the bulk of the pandemic. We continue to ask that it might be lifted. There is hope that we may see it lifted by fall, but we don't yet have confirmation on that. Believe me, we will let you know as soon as we do. I think those of us in HR are as eager as all of you. Somebody asked how we handle parking with changing work schedules. Cheryl, I think you addressed that by the remote parking option, but is there anything more you want to say on that?
I mean, I think especially as departments are working with scheduling employees, please speak to the department coordinators. They'll help navigate and communicate with us. But I just recommend managers. Some managers may already be the parking coordinator, but there's going to be a number of questions that arise, and just reach out to us and we'll try to work with the unique circumstances of the department and the individuals as this return to campus evolves. We've been doing it for the entire time that we've done multiple pivots. We will continue to do that as we bring the campus back up.
Excellent. The next question is, if an employee sits in a cubicle, not an office, but states he or she cannot wear a mask all day, minus the times when eating or if outside, what is the manager's response to that employee? We have community standards which do require mask wearing in all indoor spaces. So if somebody's unwilling to wear a mask, I think that becomes a question of really the supervisor needs to have a discussion that is an expectation of employment. And if somebody's unwilling to wear a mask, I think we have to, the supervisor needs to engage with their HR representative and employee management relations and have a discussion about whether this job is the right position. And I don't want to sound like really abrasive on that one, but we have community standards and we have expectations that are intended to both keep you and the community safe. And wearing a mask is a requirement. And if people are uncomfortable wearing masks, discomfort is not a reason for an alternate work arrangement at this point in time. So the supervisor needs to say it's an expectation and work with that employee to figure out the best mechanism for them to get a break, perhaps to go out and take their mask off and rub their face or whatever it may mean during the day. But it is an expectation of employment. I have a similar question, which is, what if I or my staff do not feel safe in our workplace? We led at the beginning that we have worked really hard to try to ensure that any plan we have for the return takes into account first and foremost the safety of our community. Our public health experts continue to tell us that the single best ways to protect ourselves and others are to be vaccinated and wear a mask. And truthfully, if you do those things, your risk is remarkably low. We no longer have physical distancing requirements. You will have the responsibility. It's not just a personal preference at this point in time, but under the new community standards to wear a mask. So we hope that with those structures in place, you will feel safe in your workplace. If you have a medical condition that would require you to not feel more at risk, certainly the EOC is a source for discussion. But much like the last question, because we are putting in place as many precautions as possible, the question of not being ready or not feeling safe is not a reason for a flexible work arrangement, but we do encourage employees to talk to their supervisors and supervisors to ask what it would take to make somebody feel safe. Is it that they're just nervous about being around that many people that quickly, and even though we don't have a physical distancing requirement, if they were able to move their desk a few feet to the right or the left, that might be better. Those are things that you as supervisors should be empowered to navigate and engage in those conversations about what would make people feel better. These are not just it doesn't work for you, find another job. That's not the conversation we want people to have, but rather we want to engage in discussions, but also be honest about the expectations that we are planning a return, and the roles we have work best in most cases when we're here, and we want to figure out the best way to make that happen. I'm conscious of the fact that we're rolling up to the end of time. We're not going to get to all of the questions, but I am going to try to address one more, and then I will remind you all to visit the hr.unc.edu return to work on campus site. The last question is, my team is asking about how we should plan to conduct meetings after we return to campus. Should that be by Zoom, in person, a mix? If it can be a mix, what criteria are we choosing, one option or another? If it's by Zoom, how should we plan for Zoom meetings to be held in office spaces shared by 3 or 4 employees when it's the same meeting or when it's different simultaneous meetings? These are all excellent questions. And a lot of this will depend on what your workspace looks like. And as supervisors, I think you need to decide what the best mode forward is for your team, likely after having some discussion about what people's comfort level is. A reminder, you are not to ask employees what their vaccination status is. That's not something we are allowed to do. So we don't want people walking in and saying, oh, is everybody here vaccinated? Take off your mask. That's not what we're doing. In some spaces, we will probably start with a lot of Zoom meetings from individual workspaces. For those in cubicles, we may need to make sure that people have headphones or headsets in order to manage that. In other spaces, it may make sense to put people in a conference room to be able to participate in the Zoom meeting, again, with masks on. You're going to need to look at your individual physical spaces, where these meetings take place, how big they are, what the outcome needs to be, and do some evaluation. But I encourage you to talk with your teams about what their preferences are and what their anxiety levels are before you just make a plan for how you're going to do everything. Again, the more conversation you have with your team members, the better, but you're not alone in navigating those conversations. There are a number of resources out there to help. HR is here to help, as are all the folks who talked to you today. We'll put more information on the website. But really, this is a new normal for all of us. It's going to require all of us to be in it together. And I want to thank you first and foremost for your work and your leadership as supervisors and managers, and open up my inbox should you have questions along the way. By all means, reach out. Thank you again. Look forward to seeing you on campus on July 19th, if not before.